Good morning. It's 9:20 a.m. on April 19th, 2021. As I said over the weekend, there were to be measures put into place today, and I will provide a written documentation that I will put online. If something has come to my attention that needs to be addressed immediately, I will keep this brief. In 2016, it came to my attention that there was an effort to attempt to launch biological weapons through the Health and Human Services system, specifically connected to homeless and domestic violence shelters. I first personally witnessed this and attempted to report on it in the manner in which I first encountered it in March of 2016. At the time, what was occurring is that people were being put into situations where they were told that in order to receive resources, they were required to participate in alleged educational activities that were supposed to be about awareness regarding communicable diseases. As somebody that had formerly worked in public health, including at a public health clinic that provided STD and tuberculosis testing, I understood upon the time frame during which I had been told I was required to participate in these trainings that the information they were presenting was intentionally inaccurate. Not only was it intentionally inaccurate, but the environment and the setting in which it occurred had been altered. My concern at that time was that what was happening is that they were doing something to intentionally distribute false information about how to, among other things, acquire such communicable diseases in order to either create conditions for being psychologically suggested into exhibiting symptoms so as to engage in acts of fraud regarding to medical treatment, or that it was connected to some other kind of biological weapons regime, and that the intentional false information that was being presented and the time frame in which it was being presented was a part of, in some manner connected to, the actual activation of those biological weapons. Prior to my experience, I had spent time, just the year before, in Central America, where there was numerous discussions regarding public health matters, specifically regarding waterborne diseases, including waterborne diseases that were not indigenous to the area. You may or may not recall that during 2015, there was considerable attention paid to some parts about an alleged outbreak of Zika, including that had occurred in Central America. There were even accusations that it had been intentionally delivered, that there had been an intentional breach of security connected to a facility where it was being tested in order to release it into the environment to test the factors associated with its spread. During this time frame, there were I believe there were two cases that were reported within the continental United States, but several areas enacted policies regarding Zika specifically, including Florida and the areas around the Gulf Coast and the Mississippi River Delta. Now, while I was out of the country, some of these things were being activated in terms of the policy that was supposed to occur as a response. When I returned, and then I experienced what I did, I made sure to note it and I made sure to attempt to report on it to the best of my capacities. As a matter of fact, I still have a copy of the original report I wrote, first submitting it to the administrators at the actual shelter, and since then attempting to take it through multiple levels, in addition to the other grievances, as a way to try to get some redress in regards to these matters. This first occurred in March of 2016. By the summer of 2016, there was in the city of Chicago a demonstrable phenomena that was not about naturally occurring seasonal illness. As a matter of fact, during the mid to late summer of 2016, I was personally witness to how at least two homeless and domestic violence shelters in Chicago were experiencing a situation wherein women that appeared to be or identified themselves as being elders, including even eligible for Social Security as a senior, and that were of African American descent or identified as African American, began exhibiting and experiencing the symptoms of a very severe flu. This included coughing, including a very loud coughing that made it sound like they were having a severe kind of problem with breathing and impacted their energy. They were weak, very weak, and were having problems, including stress, being excitated when they were in the processes of trying to acquire their resources associated with their stays in these shelters. I understood immediately that this was not a naturally occurring seasonal illness. And the fact that these people, in a time frame where, if you've ever been to Chicago, you know gets very, very hot in the summer. And not only does it get very hot, that even in concentrated spaces where there is air conditioning, there can be a variety of factors ongoing. It did not seem to me to be something that should go unnoticed. That so many people in the shelter system, specifically women, because I was in the situations where I was encountering women, I cannot say whether or not the same thing was occurring for men, but it did happen, and I was witness to it, and my concern was that it was connected to what had happened earlier in the year. Was it just the one shelter I was in where this occurred? Or were there other shelters, including potentially in other cities, where such things were being set up? Another event ended up occurring in February of 2017 when I was in Texas. My understanding is that between the first and second week of February in 2017, there was another attempt for an activation. This time I understood it as an activation. Somebody was definably and demonstrably attempting to test whether they could activate some sort of pre-distributed biological weapon that was supposed to appear as if it was a respiratory illness. The understanding is that there were a variety of ways it could be handled, including understanding that it could be treated as if it was a pneumonia outbreak, which would have one kind of response, or that it was tuberculosis or something equivalent to tuberculosis, which would have another response. The rates of contagion, the manner in which it's transmitted, as well as both the federal and global protocols for how to deal with something that is akin to these sort of things, including also the sorts of weaponization or classifications of acts of biological terrorism associated with these sorts of matters, is also different and distinct. By this time, I was aware that there was already an executive order in place regarding quarantining for respiratory illnesses that may be a part of a potential outbreak that is different than what would be activated as a response to a biological attack, and may include some sort of aerosol or some sort of dispersal method, including airborne. This happened in February 2017. Now, since then, a number of other things have happened, and I've attempted to keep track of them the best I can and report on them, including things that correlate with events outside of the country. But these things are of primary concern to me because yesterday I found information on a product presumably available to treat pneumococcal illnesses that is and has been provided by a major pharmaceutical company alleged to be instrumental at this time in developing vaccines to and for COVID-19. The time frames are exactly of what I'm speaking. And not only that, but there are other aspects of the information that have come to my awareness about this that correlate with information that has been circulating for several years concerning this specific company's efforts to engage people in illegal human test subject experimentation for other pharmaceutical products, including in Mexico. As a matter of fact, around the time that this outbreak was being attempted in February 2017, there were several things that were going on a federal level, and I personally, as part of my investigative efforts, was tracking and reporting on and attempting to bring awareness to processes of human test subject experimentation involving pharmaceuticals that had been ongoing in parts of the world for a considerable amount of time, including, but especially, parts of South America and parts of Central America, including in specifically Mexico and Argentina. These just so happen to be the locations where During 2015 and 2016, discussions around the Zika outbreak and other sorts of waterborne illnesses were at their peak. Now, I was not in Mexico in 2015, but where I was, understood that part of the transmissions, including the concern that it might enter the United States, had to do with an understanding that there was a specific immunological situation in Mexico. This company is very, very instrumental in and connected to a variety of matters that are ongoing, specifically in the state of Texas. And my contention and concern is that they have been specifically involved in processes of testing nanotechnology in order to engage in a regime of electronic warfare to trigger, activate, and distribute biological weapons with an understanding that they would be positioned and mischaracterized as the kind of company one would go to in order to engage or purchase or distribute a countermeasure. Now, I have provided public information that I have found about this. I've taken what I could find as evidence. These are serious matters. There was an announcement in the beginning of 2017 that there was a major WHO conference that was going on around the world where they were discussing, among other things, a response to a global health pandemic. Apparently, there were many scientists and many people in the immunobiological sector that believed that we were due for a pandemic. But understanding and responding to environmental factors and trying to troubleshoot or to try to develop prevention paradigms, including in manners that may involve some kind of training exercise, is one thing. There's very specific parameters around doing such things, monitoring such things, as well as informing and educating people about such things. But to have strategically timed distributions and to beta test outbreaks to see if you can accrue leverage as a form of insurance against wholesale launch of biological warfare is not the same thing. This is unacceptable. And I'm going to be honest with you, at this point in time, it really seems beyond the pale. Global leaders and people that allege that they're involved in some kind of healthcare have conspired on a level that is not only unprecedented, but is unfathomable. We have had more than 10 years of misrepresentation of what was going on specifically in the United States around healthcare. That, if nothing else, was intentionally misdiagnosing illnesses in huge, huge manners, specifically by putting people into a situation where their mental competency was questioned, if not altogether abrogated by virtue of the alleged treatment regime, and then allowed to be legally characterized in a manner that could be used by others as a justification for dispossessing them of their constitutional rights. And by and large, this was orchestrated, effectuated, and carried out by people alleging to be healthcare providers. See, the difference between being a healthcare provider and being a CBRN specialist in the military, for instance, is this understanding not only that you have in some manner committed to the Hippocratic Oath, but that you also understand that people that are involved in healthcare treatment are supposed to provide equal treatment, that no matter who you are entitled to receive the best healthcare. This is very different than the kind of strategic decisions somebody makes when they're engaged as a combatant. And this is the great crime. Racial selectivity and trying to meet some sort of demographic profile based upon how many people you're able to successfully kill in one manner or another. Or targeting specific genotypes for a specifically politicized agenda, which has been done specifically in connection with this specific alleged medication, is completely unacceptable. These are war crimes. These aren't just the kind of things, by the way, you go to war for. These are the kind of things that presumably entire societies have to galvanize themselves to respond to after the fact as a way to try to create a deterrent against ever doing them again. We've had more than 60 years where we should have gotten the point. As a matter of fact, the United States specifically had a disproportionate burden when it came to these matters. And even if you are somebody that was from another country and either ended up immigrating or are first generation from immigrants, you don't have the right to try to excuse yourself from the profundity of the implications. It's very disappointing because in lieu of any appropriate leadership that has been shown on any other level, we are left in this morass where somebody else is attempting right now to mass microchip the entire planet and call it healthcare. And that's obviously not what it is. This isn't just about securing the information grid. This isn't just about infrastructure. This is about biological terrorism that's being orchestrated by people that thug their way into government and think that they're going to command us into being their slaves. Unfortunately, what would have been appropriate as an activity by a task force in order to examine what we could do with the full spectrum of bandwidth and broadband specific to being able to secure things and democratize it, now has taken on a very demonstrably different level. The means are at hand to disengage and disassemble these processes, and I'm going to let you know this now. Attempting to intentionally interfere with or sabotage the electrical grid is considered an act of terrorism, as well it should be. There are people whose livelihoods, including their physical livelihoods, depend upon being able to access devices that require electricity. Get a generator. Today. Get a generator, get backup fuel. Today. Unfortunately, as an adjustment to what has happened over the weekend, this is the most reasonable thing I can recommend to you. Get a generator today.